Good day, everyone. In this video, we are going to continue the discussion on listening and smelling. The next one we're going to discuss is breathing. The first one is dyspnea. Dyspnea is characterized by difficult breathing. The difficult breathing is similar to the other words we used previously, panting. So the patient presents rapid breathing or breathing with an open mouth. Elevated shoulder and flaring of the nostrils and inability to lie flat. So that can indicate this is very similar to panting, the description. It can be a deficiency or excess pattern. This pattern also related to the lung. The excess and the deficiency also related to the cause of the disease. As you can see from the description there, patient with excess syndrome, excess. So when we use syndrome, or sometimes they use a pattern, it means exactly the same. So you can use excess pattern or excess syndrome. Patient with excess syndrome may present with a sudden onset, rapid, excessive, raised head, protruding eyes, strong body constitution, and forceful pulse. As you can see from here, excess syndrome have all Yang categories description. Patient with deficiency syndrome, gradual onset, compared with the sudden onset, low, feeble, and discontinuous breathing. That's rapid, a forceless pulse, or weak pulse, a forceful pulse. So that's the in and deficiency syndrome. That can indicate different type of syndrome. Again, what's the cause? What's the causes of these symptoms? What can be the possible causes of the symptoms? This is very similar to the lung. In the previous video, we have mentioned the metal. It can be the muffled metal. It also can be the broken metal. So what's the muffled metal? And such as the phlegm accumulates in the lung, it can cause hoarseness or hoarse sound or dyspnea, depends how severe they are. So when you use the theories to explain the symptoms, especially from the sound, the voice and the sounds, mostly will relate to the lung. Wheezing refers to a rapid breathing coupled with paroxysmal whistling or Moorhen sounds. So what does it mean by Moorhen sound? Here, the image on top is a short sound from Moorhen. You can hear the sounds at the background. So sometimes you can hear this kind of noise from a patient. This can indicate wheezing. It often triggered by hidden phlegm. So mostly it's the phlegm. So this is from a baby, the coughing from the baby. That's something you can hear that's very similar to the Moorhen sounds or from the animal noise. The prodromal symptoms of wheezing include itching nose, scratch or itching throat, and chest tightness and cough. The wheezing can happen with the phlegm or without phlegm. When you think about the causes of wheezing, you also think about the lung. Shallow breathing. This refers to faint breathing with a low, weak voice. Shallow breathing often associated with a weak constitution of the qi deficiency of the lung and kidney. So this kidney, the lung, is related to the breathing directly, and the lung, the function here is to receive the qi. So that's from the lung function. So the shallow breathing also can be identified into excess and deficiency. Shortness of breath. This refers to discontinued rapid breathing, similar to dyspnea. And the causes of short of breath also can be excess and deficiency. The excess from the phlegm from the exogenous pathogens, the deficiency can be the kidney, the lung deficiency. Coughing is another very common symptoms we can see in clinics. In our theories, coughing we think about the lung function of the function of dispersing and descending. And also we need to think about the kidney as well. So that's because of the descending function is related to the kidney. Coughing is primarily associated with the lung, but also be related with the other organs. The reason is because from 黄帝内经 书本 described the dysfunction of all 5 zang organs and 6 fu organs, which means all internal organs can cause a person to cough, not only the lung, such as a person with the kidney deficiency. The kidney can affect the lung, cause coughing, or the person with the liver problem. The liver is the wood. The wood can affect the metal, which is the lung, and also can cause coughing. And all these different kinds of coughing have different sounds. So that's the purpose of our studying here, to identify different sounds of the coughing or different manifestations of the coughing, such as the sounds, the quantity, the color, the quality, the quantity of the phlegm. A heavy, unclear coughing sound coupled with stuffy nose, runny nose, chill, and absence of sweating indicates wind cold. Why is wind cold and why is excess syndrome? That's because absence of sweating. The absence of sweating is the category of the cold condition. If wind heat, the combination of the wind and the heat, the patient will present with sweating. That's because the heat can cause sweating. A low, feeble coughing sound, which means the sound is low and feeble. That's the deficiency. So when you hear the coughing sound is very low, that's the deficiency. A heavy, dull coughing sound, that's the phlegm and dampness. Because of the white, perfumed, sticky sputum, that's the dampness, it's the cold dampness, it's not the damp heat. The patient presents with a sticky, yellow sputum that phlegm with damp heat accumulation in the lung. With a white, perfumed, sticky sputum, it may be the phlegm with dampness cold. A short, clear coughing sound with no or scanty sputum is dry cough, dry throat. That's the dryness, so and insufficiency. So the patient may present with a dry cough. Dull coughing sound with difficult expectoration, and yellow thick sputum indicates pathogenic heat attack the lung. Yellow, thick, that's the heat. So as you can see from here, we give you some of the manifestations and we try to help you to identify from the manifestation, from the symptoms to conclude to the causes. That's the clinical indications. How do you know it's the heat attacking the lung? Firstly, why is it the lung? Because the coughing. The coughing is related to the lung. Why is the heat? That's because of the yellow sputum. And also the difficult expiration is also because of the heat. Because the heat concentrates the sputum, becomes sticky. That's why it's difficult to it will present with difficult expiration. Here are some examples of the coughing sound. From the coughing sound, we can identify if there's a phlegm or not, or the loud or low sound of the cough. So this cough has some more clear. This is a cough. It's with phlegm, with low sound, also low and deep sound. This patient has phlegm, but not a lot of phlegm. This cough also very deep. So we can, from the different coughing sounds, we can identify the location. It's more close to the throat or deeper. When it becomes deeper, lower, it becomes more internally. That's the impact, the in symptoms. So we can identify the yin and yang from the sound. We also can identify the phlegm or not from the sound. So the more you practice, the more you will that will be more clear to you. The next one, the lung sounds. The lung sounds I put here, it is not a category that we're going to focus on in Chinese medicine diagnostics. This is the sounds from stethoscope. That we use the stethoscope to hear, to listen, and thus you will learn from the general medicine diagnostics in future. As just from here, these are some examples that we don't have in the cough sounds. You don't have to focus on the description here because these descriptions only apply for general medicine, but you can identify the sounds from this short video. The normal breathing sounds we don't hear by our ear. Most of these sounds we cannot hear by our ear from our ear directly, but just in case, like wheezing sounds, if we can hear from our ear directly, this can be the more severe condition. So this wheezing sound sometimes we can hear directly from the ear without the stethoscope. So from the last sounds, we can hear some wheezing sounds, and also if without the stethoscope, we can hear like the sounds, the cough with phlegm. If a patient can present with cough, in this condition, it will be have phlegm. So these are some of the examples of the sounds. We will focus on more on the sounds without a stethoscope. Vomiting is another very common clinical symptom. Probably most of us will have the experience, or at least we have seen vomiting before. It refers to a forceful expulsion of the contents in one's stomach. From the vomiting, we're also going to identify from the appearance to differentiate the cold, the heat, the deficiency, and excess according to the sound and the process of vomiting. Physiolo- Physiologically, weaning in pregnancy, that's the morning sick. The morning sick, if not severe, we also consider as normal. If very severe, we also can use either herbal medicine or acupuncture to help to relieve the nausea or even vomiting. The treatments also will depend on the condition, such as deficiency or excess. If the vomiting is mild, a weak, slow vomiting, or even a sound is low sound, if the vomitus is thin and clear, this often indicates deficiency cold syndrome. So until now, we have discussed many clinical symptoms. And most of the symptoms we will we will differentiate into cold, heat, or deficiency. That's how from the symptoms such as here, thin and clear, that can indicate the cold and deficiency. The low, weak sound can indicate the deficiency. Mild also can indicate deficiency. Or for mild, it can indicate deficiency or mild excess. So that's how to conclude, how to summary from the symptoms to the conclusion. can be yang deficiency. The stomach coldness is from yang deficiency of the spleen and stomach. Severe vomiting with high-pitched sound, yellow sticky sputum or fluid, and the fluid may be taste sour or bitter the patient can experience, or the vomiter has a kind of foul smell that also can indicate excess heat syndrome. Projectile vomiting is a critical condition. So if in case you see this kind of vomiting, you need to be careful that the patient need to be sent to the hospital, because this might be some conditions that increase the pressures in the head, in the brain. Although we can explain in acupuncture theories that can be the pathogenic qi entering the in level and disperse the heart, mind, and brain trauma. But for this treatment, we will have to use the Western medicine, because sometimes this kind of vomiting can cause a life-threatening disease. So the rest of the examples that you can find from the symptoms, such as the concurrence of nausea, fever, and yellow eyes, indicates damp heat. The yellow eyes is a heat. Why is in the liver? That's because also from the eyes. The eyes are the orifice of the liver, and distending feeding in the ribs area. That's also where the liver meridian distributed. Sudden vomiting coupled with the fever, chills. So the fever and chills, when we study the differentiation from the 8 principles, you will understand that the fever and chills can be the external pattern. So that can indicate some exogenous pathogens attack the human body. So this may indicate the exogenous pathogens that are attacking the stomach. Ingesting food in the morning and vomit in the evening, or ingesting food in the evening, vomit in the next morning. This is known as regurgitation. And this, in our theories, we think that the yang deficiency, the spleen yang deficiency, or the stomach yang deficiency. The reason is the patient can eat, but the food was vomited the next morning. The reason is because when they eat something and the food goes to the stomach, but the stomach have no ability to digest. That's why the food come out from the mouth again. That's the vomiting. That's also why the patient ingests in the morning, but only vomits in the evening. Drinking water when one feels thirsty but vomiting immediately is associated with fluid retention. Sudden violent vomiting and diarrhea. So in this situation, the patient will accompany with vomiting and diarrhea, especially in summer or in very hot weather. That's due to the summer heat. It also can be the cold dampness or improper diet. How do you know which causes? You can see from the tongue what's the color of the tongue. If the pale color, it might be the cold dampness. If the red color or deep red color, it can be the summer heat. If greasy color, it can be the improper diet. So that's the food retention. or thick coating. Vomiting and diarrhea also can happen after food poisoning, so that's another story. If the patient will have the history of taking something. Hiccups. Hiccups also a very common symptoms that we can see in our daily life. For hiccups, similar to vomiting and nausea, we also going to identify into excess or deficiency, heat or cold, from the duration, the sound, and also the time between the hiccups. So for excess, for yang syndrome, so heat syndrome, you always high pitch, forceful, or low, weak, that's yang deficiency. High and forceful, that's excess heat. Deep, slow, indicates excess coldness. Forceful. Why is excess? That's because of forceful. Or if weak, that's a deficiency. So that's how to identify these different symptoms. Mild hiccups sometimes can be, especially for pathological conditions, in pathological conditions, can be resolved automatically. Belching. Belching refers to adverse ascending of the stomach qi and relief of gas from the stomach through the mouth and throat. The belching, the difference between the belching and hiccups, the belching, the, the process of releasing gas from the stomach takes longer in belching. So for this session, we also going to identify into, we also going to differentiate into cold heat deficiency and excess. So you can just go through by yourself and try to understand what's the cause. And so we're not going to go through one by one. So for these few symptoms, you can just go through by yourself. And sneezing also very common happens in, especially with the like flu-like symptoms or external pattern. Yawning. There's one more that we want to emphasize is the signing. Signing is a sign of liver qi stagnation. So signing, what that is, the patient will, you can hear, or the patient will tell you that after signing they feel better. So what's the clinical manifestation is the patient can experience this kind of sound. So this kind of sound after signing, the patient will feel better. That's the liver qi stagnation. And bowel sounds. So the sounds from the bowel movements, the intestine movements. It can be the large intestine or small intestine movements that can indicate different conditions of the human body. We also going to identify from the how loud or low voice, loud or low sound from the movements. We're also going to combine with the other diagnostic method. In this video, we have introduced some common clinical symptoms. From the discussion in this video, you will understand that the clinical symptoms we need to differentiate the coldness, the heat, the excess or deficiency patterns from these manifestations. That's from their sound, how loud or how low the sound. Also the other symptoms and signs that we can gather from the other diagnostic methods. So after study, until now we have studied the inspection, the inquiry, and now the listening, and the next video we're going to talk about the smelling. So the more we study in your consultation, you're going to combine these different diagnostic methods to help you to gather the information you need from your for your diagnosis. And the listening, such as the listening here we talk about, from the vomiting, all the voice, the sounds that we mentioned in the last video, in the previous video. These this listening diagnostic process will happen in the conversation from inquiry. So the moment when we see the patient, from the greeting, we already started the diagnosis listening. So this is not something one by one. The inquiry, the listening, something happens at the same time. So we need to have this kinds of, we need to keep in mind that in the conversation, we're also going to identify the voice, the sounds from the patient. So in the next video, we're going to talk about the smelling. Thank you for your attention.